With ADPKD, our kidneys are failing or losing function year after year. So it's not gonna be all of a sudden I'm gonna wake up and feel like, oh, I need to be on dialysis. Although we talk about rapid progression, it's gonna take time for us to get from, for example, kidney function of 50% down to 10%. Now it's important to kind of each of the CKD or chronic kidney disease stages to get the right management. Early on, we don't need a lot of interventions and blood work, but as we advance with the chronic kidney disease down to chronic kidney disease stage 4, that's more advanced chronic kidney disease, and stage 5, which means kidney function or GFR less than 15, then there's going to be more monitoring for the electrolytes, making sure the potassium is not elevated, making sure the diets are adjusted accordingly with a low potassium diet. And then as we get closer to the chronic kidney disease 4 and 5, we need to understand what are our options to replace the kidney functions.
When our patients in the PKD Center of Excellence transition to stage 4 and 5, we move them over to our CKD clinic. In our CKD clinic, we monitor the progression of kidney disease and we try to delay progression as much as we possibly can. We also incorporate renal replacement therapy classes one-on-one with nurse practitioners such as myself or one of my colleagues, where we discuss dialysis options such as peritoneal dialysis and hemodialysis, and we review the advantages and disadvantages.
Unfortunately, some of these patients, despite treatments for polycystic kidney disease, their chronic kidney disease does advance. And when their kidney disease advances to the point where they have about 20% kidney function, or in medical terms, glomerular filtration rate of 20 and under, at that time we refer them to our transplant comprehensive center for transplant.
If the kidneys as an organ are failing, we need to replace their function. So one could be transplant, but sometimes either we're waiting for transplant for various reasons, or we can't get transplant, then it's important to be ready for dialysis. My main thing for our patients to advise them not to wait for the last minute and be in a very kind of health crisis and come to the emergency department with very high potassium and rushing to get them to dialysis. It's important to be proactive, which means as the kidney function is declining, it's important to realize, okay, now it's the time to start dialysis.
They are referred to vascular surgery team so they can have a fistula created. This is a surgery that entails connecting the artery to the vein in order to create a fistula. So this would be the access point where we insert the needles, where dialysis will be completed.
So there's multiple ways of doing dialysis. Many of them can help us with the quality of life, so it's a little bit more control if you're doing home hemodialysis or doing dialysis at night and then working during the day. Because of course our PKD patients are younger, they're in midlife, they're at the peak of their productivity, so we want to give them all the chances possible to continue to have as normal to what they've had as possible. Now with dialysis, whatever the modality is, it's trying to replace the kidney function, so dialysis is trying to filter the blood or filter the blood through hemodialysis, or use the belly membrane to kind of also take all these toxins out. So we want all the toxins that build up that are supposed to be filtered by the kidney, we want to do that and crunch it kind of in with the machine. So either the hemodialysis machine, which is 3 to 4 hours 3 times a week, or hemodialysis, which is a couple of hours more times during the week, depending on the situation, or doing almost every night for 8 hours at night slowly through the peritoneal dialysis. So dialysis in general, it's a form of replacing the kidney and trying to take away those toxins, taking away those extra fluids, because if we're not making urine, everything we're drinking is going to stay in our body until we get it dialyzed or filtered. And then also the electrolytes, especially the potassium and the phosphorus. So that's also a different kind of area where your dialysis doctors would be the right team to help you get through dialysis and make sure that you're doing everything possible to get the best care possible.